The reproductive system's worth 2 questions in your exam paper. You do need to have an understanding of both the female and male reproductive system, as well as some of the common diseases and disorders that you might suffer from, which are related to the system as well. The male reproductive system consists of the prostate gland, the testes, the testicular vessels, the scrotum, and the penis. And we are going to have a look at each of those organs involved in male reproduction and have an understanding of what each of them do. The prostate gland you might be familiar with already. It is the size of a walnut and located between the bladder and the rectum, and it is a common problem in men to get cancer of the prostate gland. The function of the gland is to keep the lining of the urethra moist, and it's part of the seminal fluid system helping semen to travel along the urethra. So patients who have problems with prostate gland might find if the gland is swollen or if it increases in size that it presses either on the bladder or the rectum, normally the bladder, which means that frequency of micturition, which means urination, is something that the patient might suffer from. In order to have an examination of the prostate, it does mean that a finger has to be placed up the rectum in order to feel if the prostate is swollen or not. The testes are also known as male gonads or sex glands, and these are located in the scrotum, which is a sort of baggy sac that hangs underneath the penis. The testes are developed in the abdomen and drop down through the inguinal canal into the scrotum just before birth. The function of the testes is to produce sperm, or spermatozoa is the longest name of it, to produce testosterone and to store sperm. The sperm is kept at a slightly lower temperature than the body, about 35 degrees. So the testes are the male sex organs located in the scrotum, and they produce sperm, testosterone, and store sperm at a slightly lower temperature in the body. The testicular vessels are 2 tubes which form passageways from the testes to the urethra. Within these testicular vessels we have the epididymis and we have the vas deferens. The epididymis opens the top of each testes and continues down the side and straightens out into the vas deferens. Its job is to store and transport sperm, and it's the site of immature sperm development. So I like to remind myself that the Diddy Men from Rolf Harris's children's television program is found in the epididymis. So the immature sperm develop in the epididymis, in my mind, as Diddy Men. The vas deferens is a duct with a muscular wall leading from the epididymis to the urethra, and during sexual activity this contracts, pushing sperm from the epididymis through the prostatic urethra and then into the penis. The scrotum is the external sex organ that hangs under the penis. This sac containing the testes, the epididymis and the vas deferens. It's got an outer layer of skin and an inner layer of muscle, and there's a membrane that divides it in 2 halves, one for each testes. It supports and protects the testes and controls the temperature that's slightly below normal temperature, about 35 degrees. So it contracts when the temperature gets very cold and relaxes when the temperature gets very hot. I think scrotum is an amazing word. I think it's a very, very nice word, and I would love to go into a pub and ask one of these real ale pubs and ask them for a pint of the old scrotum, just to see what the reaction is. So scrotum, external sex organ hanging down behind the penis, which contains the testes, epididymis, vas deferens, supports, protects the testes and controls the temperature. The penis The structure of the penis is made of 3 spongy erectile bodies which are full of erectile tissue which fills with blood on erection. The bottom one below contains the urethra, and there's glands at the tip of the penis surrounded by foreskin. There are two functions of the penis. One is to get rid of waste matter in the form of urine, to excrete urine, and the other one is to produce sperm and to act as an organ of reproduction. So during reproduction, during arousal, the 3 spongy erectile tissue bodies fill with blood, which allows the penis to become erect. This then allows it to enter the vagina and deliver the sperm. Sperm look like microscopic tadpoles. They have a head, a middle, and a tail. The head of the sperm contains 23 chromosomes, which when it fertilizes an egg, it adds to the 23 chromosomes within the egg, and that's what makes up the baby. Of the million of sperm ejaculated, only 1 needs to fertilize an egg. And these swim like mad up through the vagina, up through the cervix, into the uterus, and hopefully when they get there, the uterus will have an egg travelling down into it. They might have to go a little bit further along the fallopian tubes to find an egg, but only 1 sperm needs to manage to penetrate an egg in order to start the growth of an embryo into a baby. The semen is how the sperm are secreted into the vagina. So the fluid discharged during intercourse is called semen, and this contains sperm and secretions from the prostate gland and the seminal vesicle. So sperm are microscopic tadpoles which contain 23 chromosomes, and their function is to fertilize the ova. These days, a lot of men's sperm is not as strong as it should be. Microwaves and diet and alcohol are all supposed to be having an effect on whether the sperm is actually capable of swimming the distance it has to go to fertilise an egg. And a lot of men's sperm can be seen under a microscope to be going round and round in circles. Some of them have 2 tails. Some of them seem to have no sense of direction at all. And a lot of sperm is quite immature. So it is becoming more and more of a problem to have healthy sperm. And this is where test tube babies come about, where a sperm and an egg is actually brought together in a test tube in order to make sure fertilization actually happens, and then those fertilized eggs are put back inside the uterus in order to embed and hopefully turn into a baby. The female reproductive system contains the uterus, the cervix, which is the opening to the uterus, the ovaries, which are where eggs are produced, the follicle, which is what holds the eggs in place, the fallopian tubes, which are the tubes from the ovaries down into the uterus, the vagina, which is the opening into the sexual reproductive system and also up into the urethra, and the breasts. So the uterus, cervix, ovaries, follicle, fallopian tubes, vagina, and breasts. The uterus is the centre of female reproductive system, also known as the womb. And fertilised eggs, or fertilised ova, ovum, develop in the uterus. It's about 7.5 centimetres long and 5 centimetres wide, and the lining consists of layers that thicken every month to act as nourishing beds for the ovum. So the function of the uterus is a place where the fetus grows in pregnancy. The lining of the uterus is known as the endometrium, and quite often inflammation of the endometrium is known as endometriosis. The uterus, if you have the uterus removed, it's called a hysterectomy, and the term hysterical comes from the uterus. It was thought in the past that women became hysterical when they had problems with their uterus. So a hysterectomy is the name where the uterus is removed. A full hysterectomy is where not only the uterus is removed but also the cervix with it, and sometimes the ovaries and fallopian tubes as well, although normally they would tie those off and keep the ovaries and the fallopian tubes to help us balance the hormones and still keep producing hormones. So the uterus, to recap, is the womb. It's where the ovum or ova develop when they have been fertilized. Now, if an egg is not fertilized, that egg that embeds itself in the uterus every month, and the thickening that happens in the uterus every month is shed in the form of our periods and menses when the egg is discovered that it's not going to grow into a baby, we don't need it anymore, so we end up having a period. The cervix is a structure found at the end of the vagina, at the beginning of the uterus, and it's a narrow neck which controls what is allowed into the uterus. During childbirth, the cervix dilates, and the measure of how wide it is dilated tells a midwife how soon childbirth is going to happen. The function is that it forms the first part of the birth canal. When we have a smear is where tissue samples are taken from the cervix and looked at under a microscope in order to check that everything is normal, there's no malfunction of cell growth, there's certainly no cancer on the cervix. If we get an indication that there's an abnormality of cells on the cervix, cancer can be caught at what we call stage 0, which is almost immediately able to be eradicated. So this is why over the age of 30 women have a regular smear. The ovaries, also known as the female gonads or glands, about the size of an almond, and they sit either side of the uterus but below the fallopian tubes. They secrete two hormones called progesterone and estrogen, and their function is to store the ova or the eggs. We're born with ovaries full of eggs, although they are immature eggs. And ovulation takes place every month, which means that the follicle ruptures and releases an egg every month. That egg then travels down the fallopian tubes into the uterus, where the uterus is already lined and thickened, waiting for the egg to arrive. And if along its journey a sperm manages to swim its way up the vagina through the uterus and penetrate an egg, then an embryo will form and a baby will grow. And the egg then lodges itself in the uterus, and the lining of the endometrium will be what nourishes that egg as it grows. The Graafian follicle is a small structure which sits on the surface of the ovary, and when it's mature it contains fluid and an egg, and when mature the follicle splits, releasing the ovum or egg which travels along the fallopian tubes to the uterus. So I suppose the job of the Graafian follicle is to ripen and mature the egg, and when the egg is ready to travel along the fallopian tube, the mature follicle splits, releasing the egg. The fallopian tubes are funnel-shaped tubes which start at the uterus and continue out to the ovaries. Their function is to act as a passageway from the ovaries to the uterus for the egg or ovum. The site of fertilization is often along the fallopian tubes. A sperm that's been ejaculated into the vagina travels up through the cervix, through the uterus, and then up along the fallopian tubes, and they swim up to reach the egg. The egg can be fertilized at any time once it's left the Graafian follicle as it travels down the fallopian tubes into the uterus. Sometimes, as the egg travels down through the fallopian tubes, it becomes fertilized and gets dislodged and starts to grow in the fallopian tubes. This is known as what is called an ectopic pregnancy, which can be extremely dangerous because if the fallopian tube perforates because the egg gets too big in the fallopian tubes, it can be life-threatening, and it also affects future fertility for that fallopian tube. So an ectopic pregnancy is when an egg is fertilized and embeds itself in the fallopian tubes, starts to grow there instead of in the uterus. The vagina is a muscular passage from the cervix to the vulva. It's a passageway for menstrual blood when an unfertilized egg is shed and the lining of the endometrium is shed because it's not wanted, because there is no fertilized egg once a month. We have a period instead. It's also, the vagina is part of the birth canal, and in penetration during intercourse, this is where the penis is inserted during intercourse with the hope that as a final result of the intercourse that ejaculation of semen will produce sperm that'll swim through the cervix, through the uterus, and then along the fallopian tubes looking for an egg that it's going to penetrate and fertilize. The external part of the vagina is known as the vulva, and this is protected by the mons pubis, which is a sort of fatty mound covered in hair, and the lips of the vagina opening are known as the labia majora and the labia minora, and the clitoris is there marked in C. You can clearly see a tiny little protuberance which is responsible for making the female partner in intercourse excited and then lubricated, and it's also responsible for a female orgasm. The breasts are also known as the mammary glands, and inflammation of the mammary glands or breasts is known as mastitis. They are accessory organs in the sexual reproductive system for women. They develop during pregnancy as a milk-secreting gland. They consist of adipose and areolar tissue, and an area around the nipple is known as areola, and then you have the nipple itself. The lobules develop during pregnancy and secrete milk. So the breasts are an accessory organ in order to stimulate arousal during intercourse, but they develop milk during pregnancy, and it's the lobules in the breasts that secrete the milk, and the milk production is known as lactation. So the breasts are also known as mammary glands. The inflammation of breasts is known as mastitis. The production and creation of milk during pregnancy and the secretion of milk is known as lactation. And one of the most important things to remember here is what tissue we have in the breasts is adipose and areolar. Now, areolar tissue should not be mistaken for the brown colouring around the nipple, which is called the areola. Sexual reproduction is also known as meiosis. There are 6 stages of pregnancy: fertilization, post-fertilization, cell division, formation of the embryo, the development of a fetus, and birth. We used to have in our syllabus quite a lot of information we had to learn about these 6 stages of pregnancy, but ITEC these days don't require us to learn to that degree. But I am going to enclose a video from YouTube to quickly cover what happens in these 6 stages. An ectopic pregnancy is where an egg has become fertilized and develops in the fallopian tube instead of traveling down to the uterus. It can become an extremely painful condition, and in the end you can have hemorrhages, which is bleeding, and it can cause death, because a rupture of an ectopic pregnancy in the fallopian tubes can mean that the fallopian tube hemorrhages, and it can be life-threatening. Dysmenorrhea is the name given to extremely difficult and painful periods. It's usually caused by a spasm or congestion in the uterus, probably because of an imbalance of hormones or an emotional disturbance. So dysmenorrhea is painful periods, maybe extremely difficult periods, maybe the periods are erratic, but when you do have them, they're full of clots and causing an awful lot of pain. Amenorrhea is the absence of menorrhea, or the absence of menstruation, usually due either to hypersecretion of testosterone in females or other hormone imbalances. It could be brought on by stress. If there's a radical weight loss in the body stops immediately ovulating and producing a period. Or if you're excessively anemic, you won't have a period either. Excessive exercise can also have the same result. Menorrhagia is the name given to heavy periods. Premenstrual syndrome is also called PMS or PMT. Usually it's a sign of the onset of menstruation, and usually occurs about a week before a period. The effect can be depression, irritability, bloating, water retention, maybe swollen or tender breast tissue, restlessness. So these are all symptoms of PMT or premenstrual syndrome. There's lots of reasons why a female might suffer from infertility, and some of those are endocrine disorders, or obstructions maybe in the fallopian tube, or some reason why the eggs are not releasing on a monthly basis. Malnutrition or low body weight will cause the body to hang on to every ounce of fluid and tissue that it can. It goes into a starvation mode, so it will stop ovulating and causing menstruation. Anatomical abnormalities where there may be a growth, or there might be a genetic reason from birth as to why the passage of the eggs is not reaching the uterus. An endometriosis might develop, which is an inflammation of the lining of the endometrium, so that the egg can't take a hold of the endometrium and grow and be fertilized. So there are lots of different reasons, and there's a very good YouTube video that I've attached next that goes into it in a little bit more detail and a little bit more coverage.
Like female infertility, it's very difficult to put a finger on male infertility. 34% of male infertility is unexplained, but they would look into endocrine disorders, whether there's an obstruction stopping somehow the sperm releasing from the male body. There could be a sexual dysfunction, so an impotence of some sort, There could be a vasectomy, which would obviously impair male infertility. Could be a drug-related side effect or a low sperm count. There's lots of different reasons why men could become infertile.
The uterus is the centre of female reproductive system, also known as the womb. And fertilised eggs or fertilised ovum develop in the uterus. It's about 7.5 centimetres long and 5 centimetres wide, and the lining consists of layers that thicken every month to act as nourishing beds for the ovum. So the function of the uterus is a place where the fetus grows in pregnancy. The lining of the uterus is known as the endometrium, and quite often inflammation of the endometrium is known as endometriosis. The uterus, if you have the uterus removed, it's called a hysterectomy, and the term hysterical comes from the uterus. It was thought in the past that women became hysterical when they had problems with their uterus. So a hysterectomy is the name where the uterus is removed. A full hysterectomy is where not only the uterus is removed but also the cervix with it, and sometimes the ovaries and fallopian tubes as well. Although normally they would tie those off and keep the ovaries and the fallopian tubes to help us balance the hormones and still keep producing hormones. So the uterus, to recap, is the womb. It's where the ovum or ova develop when they have been fertilised. Now, if an egg is not fertilised, that egg that embeds itself in the uterus every month, and the thickening that happens in the uterus every month is shed in the form of our periods and menses when the egg is discovered that it's not going to grow into a baby, we don't need it anymore, so we end up having a period. Vulvovaginal candidiasis is another name for thrush. It's an overgrowth of yeast, a fungal infection, with unpleasant symptoms like itching, soreness around the vagina, maybe even a discharge. Prostatitis is inflammation of the prostate gland. Hysterectomy is the surgical removal of the uterus or womb. Benign prostatic enlargement or hyperplasia is an enlargement of the prostate gland, which is not malignant, it's benign, so it's not life-threatening. Frigidity is the name for a low level of sexual desire. Impotence like frigidity is also known as erectile dysfunction. And there could be physical reasons for it, there could be very psychological reasons for it. Ovarian cysts, these are cysts that develop in the ovary, and quite often they can become the size of a grapefruit. When I was nursing, we had 3 ladies admitted with ovarian cysts that really were enormous. One of them was the size of a grapefruit, another one was the size of a football. And these women would have known that they had a lump growing, but sometimes, people get very concerned about going to the doctors, particularly with symptoms that have been going on for a while. Pelvic inflammatory disease is a generic term for any inflammation, maybe of the uterus, the fallopian tube, or ovaries in this area for a variety of reasons. Preeclampsia is a condition in a pregnant lady where blood pressure suddenly rises, there might be fluid retention. It's a sign that there's something wrong with the pregnancy, and it can be life-threatening. A prolapse can be either of the uterus or the vagina, where the uterus bulges into the bladder, causing pressure on the bladder and increased micturition, or pressure on the bowel, making you want to go to the toilet more often. It's a condition where the organs, such as the uterus, fall down or slip out of place. Toxic shock syndrome is a rare life-threatening illness caused by a toxin, quite often with tampons. If you left the tampon situated in place for too long in the vagina, it was thought that toxic shock syndrome could be picked up by the toxins in the tampon because they've been left there too long. Polycystic ovarian syndrome is also known as Stein-Leventhal syndrome. This is a hyposecretion of female sex hormones or luteinizing hormone. This produces irregular menstrual cycle, multiple growth of follicular ovarian cysts, sometimes infertility, enlarged ovaries. 50% of patients are obese and become hirsute. Hirsutism is the other name for hairiness on the body. The age range for polycystic ovarian syndrome is between 16 to 30. I like to ask a lot of questions about polycystic ovarian syndrome or Stein-Leventhal syndrome, and about the fact that it's a hyposecretion of female sex hormones, and hirsutism comes up an awful lot in the reproductive questions. Cancer of the reproductive organs is quite common. And these are malignant cells that are produced either in the breasts, ovaries, cervix, testes, or prostate. Cancer of the cervix is tested every 5 years in women in their smear test, and women should really be checking their breasts regularly for any unexplained or unnoticed lumps or bumps. The same with men, they should be checking their testes and their prostate and making sure that they don't have any explained lumps or bumps either. Another name for breasts is mammary glands, and inflammation of the breast is known as mastitis. This is usually caused by a bacterial infection via the nipples, often in a period after breastfeeding where bacterial infection gets into the nipples after nipple bleeding or cracking. But mastitis can also come about if you exercise without a support bra and the breasts are not supported during exercise. You can end up with mastitis. In my experience, women who have mastitis are usually quite flat-chested, and tend to maybe not support their breasts as well as more larger breasted ladies. Galactorrhea is lactation in men or women who are not breastfeeding. It is generally due to a prolactin secretion by the pituitary adenoma. A fibroadenoma is a benign, not cancerous breast tumour that are made of glandular and fibrous breast tissue.